Good afternoon, and thanks for joining us. I'm Brooke Nolman, a Client Solutions Executive here at Employers Health. Before we get started, I have a few items to cover. Currently, all attendees are in listen-only mode. Please use the Q&A function on the left-hand side of your console to submit questions. We will address them at the end of the presentation. Upon exiting the webinar, you'll receive a survey to provide feedback. We appreciate all attendee feedback as it helps us shape our future programs. Joining us today is Casey Ford and Travis Tate from CVS Health. Casey is the Assistant Vice President of Clinical Accounts and Services for the Employer Group segment. As the clinical leader, Casey is responsible for leading, coaching, and mentoring a team of clinical directors, advisors, and analysts. Her team is responsible for ensuring that CVS Caremark is meeting the clinical needs of its clients and using its clinical and managed care experience to provide consultative solutions. Travis Tate is Vice President, Formulary and Trend Solutions with CVS Health with a focus on ideation, innovation, and management of clinical products and services. As a senior clinical leader, Travis leverages his extensive experience as a client to influence strategy and development of cost management solutions within the organization. Currently, Travis and his team are focused on formulary and utilization management strategies with a focus on biosimilars, GLP-1s, and specialty cost containment. Travis brings over 19 years of experience in the pharmacy sector to his role, including 5+ years in executive leadership at an employer client. Casey and Travis, I'll let you take it away.
Sounds good. Thank you very much. And as introduced with a fantastic introduction, I am Casey Ford. So I'm going to kick us off today, and Travis and I are going to start to talk about biosimilars in general, but I'm going to start with the basics of what is a biosimilar product, as well as tell you why we're talking so much about them lately. But I think before I determine or define what a biosimilar is, it's important to define and start with what is a biologic product to start. So a biologic product is a large molecule product, and it is made from living cells. So this is important. Examples of these are many specialty products, injectable medications like Humira, which you will hear us mention several different times today for good reason, or even non-specialty products that are injectables. So insulins are actually biological products as well, which are made from live cells. These are different from non-biologic products, which many times are in a pill form that are made up of manufactured ingredients. Examples of those would things be like Lipitor or Nexium that we're all familiar with. So now that we know what a biologic is, what is a biosimilar? Well, a biosimilar is also a biologic treatment, so it's also made from living cells, and it's just as safe and just as effective as existing FDA-approved biologics, and those are referred to as our reference product. So for example, Humira is an FDA-approved biologic, and that is an example of a reference product that we'll use today in discussion. So this is similar in concept to what a generic medication would be, but different in that generics have the same active ingredient as the brand name products, so same exact active ingredients, whereas biosimilars are highly similar to their reference or parent product, but not identical because they are made up of living cells. So while this presentation today is about biosimilars in general, for good reason, Travis and I will reference the activity within the Humira biosimilar space, as well as biosimilars as a whole that have recently been released into the marketplace. So what we're looking at here is a biosimilar pipeline over the next few years of what we expect to see. And much of conversations today will be about these biosimilar launches. Again, Humira, where we've had several biosimilars launch in this space for this medication already this year. It's exciting to see that we also have this going to be followed by additional entrants over the next few years, including the much anticipated biosimilar for Stelara, which we expect in 2025. And for all of you, I know you've heard the name. You cannot get away from direct-to-consumer advertising. So Stelara is used to treat things like psoriasis, Crohn's disease, ulcerative colitis. And many of these products are in the autoimmune class of medications, or the AI class. And this is the highest trending drug class. So each one of these new products that launches with a biosimilar is going to shift the market dynamics within this space. We also have, in addition to this pipeline slide, we have a couple of pipeline slides with more detailed information of what we can expect in the next few years with the launches in the appendix for your reference as well. A lot has changed in this space, so this graph is pretty impactful. Since 2015, there have been 43 biosimilars that have been approved. Of those 43 biosimilars that have approved, we've seen 37 of them released today into the marketplace, and this represents and covers 11 different medications. Now, up until recently, the majority of these medications were typically utilized and seen under the medical benefit, and we are seeing that that is starting to shift with the biosimilars for Humira. And you can see on this graph that we do expect significant growth, so much so that in the US biosimilar market, it is anticipated to grow from, in 2022, they estimated about $9.5 billion in spend for biosimilars. Well, by 2029, we expect about $100.9 billion in spend within the space. So it's going to really increase over the next several years. And there's been so much buzz about this and excitement because AbbVie's Humira is the highest selling drug in the United States. Whereas in 2021, the US revenue for that one medication alone was $21 billion. And, clients, we've been long anticipating the entry of biosimilars into the marketplace for this product. And it has finally come. The time is here, and that's why we're talking so much about it today. And I think the question for all of us today is, why does this matter? Why do we care so much? Well, biosimilars, they're disrupting the drug market, but they're doing it in a good way. They're helping to drive down costs for providers, for payers, as well as our consumers. And a recent analysis shows that the opportunity of value of biosimilar products that have launched already, or we do expect to launch within the next several years, valued at about $75 billion by the year 2030. And why is this? This is because increased competition is helping to solve and will help to solve the challenge that we have with specialty drugs. Whereas new entries within this class, they're going to create additional competition that's going to enable us to lower costs for our clients. This could be directly with the use of biosimilars, or it may be with a current reference brand product that we're now able to negotiate a lower net cost due to the competition in the space. So it's not just the biosimilar which becomes more affordable. The average sales price for the reference brand products are driven down with the biosimilar competition as well. So Humira, as well as the other autoimmune reference products that we've talked about in the biosimilar space and the upcoming pipeline, as we said, each one of them is going to shift the marketplace dynamics significantly. Whereas if you look at this chart here, autoimmune treatments, they account for almost half of all specialty utilization trend, coming in at about 49%. Behind that, we have asthma and atopic dermatitis, about 32% of the trend. And then a big drop off. And next up being oncology, 6%, infertility, 1%, as well as 1% for hormonal therapies. So I want to talk about what we think about. So let you into our mindset here of when we are thinking about if we're going to prefer a reference brand or a biosimilar on our formulary, what goes into the consideration? So what is important in that decision? Now, this first slide is going to be more of high-level overview of the biosimilar or reference brand space in general. And then the next slide is going to be more specific to the Humira biosimilar space, as that's top of mind for all of us. So the first and foremost, it's clinical appropriateness and efficacy. So can the medication treat the conditions that it's approved for and needs to treat, and does it work, as well as is it safe? And then we're going to take a look at the different product attributes. So this could be slightly different for each one of the medications, but it includes things like the formulation. So the concentrations or strengths available. Many different medications come at many different strengths. Are the biosimilars also available at the same strengths and the same dosage forms as the reference brand product? Are they citrate free? So I'm sure you've heard this said in the marketplace, but what this means is, and it is relevant in Humira space, as I'll go into on the next slide, citrate-free formulations when injected are much less painful for members when injected than if they contained a citrate product. You will see as we do a comparison of the biosimilars that have come out today so far that most of them are citrate-free, but this is important to the member experience if it's going to be a painful injection or not. So it's something that we're definitely considering as we look at the products. And then how easy to use is the device? Whether it's Humira or a different biosimilar that's coming to the marketplace, we want to make sure that the member can use it, it's easy to use, and they understand how to use it. So definitely something that we're considering. And then the reliability and quality of the manufacturing, as well as the supply chain. So if we select a product on our formulary, we need to make sure that there's enough of the product in the marketplace that's being produced at the highest quality to be available for our members. Because if our members can't get the medication, they can't take it, and it's not a great strategy. And then lastly on here is the price. So achieving the lowest net cost. And when we say lowest net cost or lowest cost, this decision is not just going to be based on the price of one drug compared to the price of another drug, but we also have to consider how effectively utilization can change between them. So it's not an effective strategy, and it's not going to save money if we can't get members to take the selected product or move them over to it. As well as, lastly, we do consider if there's availability of manufacturer copay assistance programs in the marketplace. And then when we take those concepts that I just talked about on the last slide, and if we focus specifically about the Humira and the biosimilars, what are the differentiators amongst the biosimilars for Humira that we're taking a look at? Because that's been one of the products that's obviously top of mind. And I'm also going to show you, I'm going to overwhelm you after this with a side-by-side comparison and list of all the biosimilars that have been launched today, so you can see just how complex this is when we compare everything and we show you side-by-side of all the different attributes that we have to look at when we're making a decision. So in no certain order, let's start with concentration. There are two concentrations of Humira in the marketplace available today. There is a high concentration and there is a low concentration product. The high concentration formulation is a preferable product, as most of the patients are currently receiving it, so much so that 85% of members are on the higher concentration product today currently. We're also looking at, as I said, is it citrate free? So we do not want to pick a product, or it's not preferable to pick a product that members aren't going to enjoy the experience and it's going to be painful for them. It is important to note as you look at the chart, because I didn't realize this, when you look at the chart, I said, 85% of members are on that higher concentration Humira product, which means a lower percentage, or about 15%, are taking the low concentration. The low concentration Humira product, the reference product today, does contain citrate. So that's something, as we look at that for the lower concentration, knowing where members are coming from and what they expect to the experience today. So something to note you'll see on the chart that I wasn't aware of before we created the chart. And then, as mentioned, availability in the marketplace. And Travis is going to talk to you a little bit more in his slides about how we're looking at the availability, what we think we can do to help with the space and the availability, and really how we can impact the availability and manufacturing of these products. The delivery system. So this is really important. How easy is the device to use? And I spoke of it on the last slide, but more specifically, when we speak about Humira, we know it's important because this medication is approved for rheumatoid arthritis. Those patients, a lot of them have dexterity issues, so they might have some joint deformities. So making sure that they can hold the device, they can press down the injector, that it is easy for them to use, this is extremely important for members, and is very important to us to make sure that they have a good experience and they can utilize the device that we select. And then lastly, pricing strategy in here. Oh, second to last, pricing strategy. So rebates and non-rebate strategies can be important in the marketplace, to PBMs, to payers, as well as specialty pharmacies, and they can influence formulary decisions. On the chart, you're going to notice that biosimilars are coming to the marketplace with various pricing strategies and various list price. Some are coming at a high list price, where the manufacturer maybe still be offering a rebate, as well as they're coming at a lower list price, or a wholesale acquisition cost, otherwise known as WAC, where there might be lower or no rebate offered, but the medication is coming to the market at a different price. So getting to that low net cost strategy with our preferred products, it's important to us, and we have a lot of different things that we have to look at to get to that strategy. And then lastly noted on here is the interchangeability designation. Big word, what does it mean? So while this designation is preferable, it's not essential, But what it means is that for a biologic product or a biosimilar to be deemed to be interchangeable, which means that it can be substituted for the reference product without a new prescription needed, it has to get additional approvals and go through additional pathways to do so. So it is an extra step. I will caveat that by saying there are specific state laws that differ by state that could influence the interchangeability laws depending upon a product. So I will leave with that too. And before I turn it over to Travis, I do feel the need to completely overwhelm you. This chart is so long. These are the different attributes of what we're looking at. It is a comparison with Humira being the reference product at the top. And it includes the biosimilars that either have launched or we expected to launch. And you will see the launch dates on here with all the different attributes that I just mentioned included here as a side-by-side comparison. So there's a lot to take in here. Again, I don't expect you to take it all in, but as I look at this slide and I look at, there is 2 slides, the second slide to cover all the biosimilars that are expected to be launched today, a lot to consider and a lot in the marketplace, which is exciting because we said competition was good and we're excited about that competition. What I did realize was that I failed to include a slide on here to talk about what is our strategy in this space today, which probably is important to all of you. So I will speak to it. Travis will reiterate it, figuring if we say it more than once, maybe you will recall it since we forgot to put it on the slide. Today, we recently announced about a month or so ago, just as a reminder, our preferred strategy within this space is we do prefer on our standard formulary, brand name Humira is our preferred product, as well as Hyrimoz, and the unbranded adalimumab, which I've avoided saying up until this point because it is a bit of a tongue twister, the Sandoz version product are our preferred products. They are equally preferred on our formulary today. So Travis, I know I said a lot. I will pass it over to you. And you can take it away.
Yes. All right, sounds good. So, I'll first comment and just say that while most pharmacists know how to pronounce the names correctly, a lot of the new ones that are coming out in the biologics are difficult. So sometimes you just have to say it with confidence and go from there. But I have heard it pronounced adalimumab. I know that that's the correct way to pronounce it. But so let's talk a little bit about what all of this means. And I'd say in general, as you can see on this slide here, one of the things that we feel very passionate about is that it's very important to invest in the biosimilar space. And so I'll get to a little bit of how we're doing that here in just a second. But, as Casey noted on some previous slides, and as you can see here, we expect the market for biosimilars to grow to, more than $100 billion by 2029. And so that's pretty significant. From our perspective, competition is the best thing in the world to help drive prices down at the end of the day. That doesn't necessarily mean you always have to go with, say, a biosimilar first strategy, but it helps drive down prices for everyone. And so I've talked about this on pretty much every webinar I think I've done on biosimilars, and I stopped using the slide just to not be repetitive, but one of my favorite talking points is if you look at what's happened with Remicade, multiple biosimilars came out back in 2017. And when that came out, they came out at just barely a discount compared to the brand. And then over the next 4 years, you saw a significant price drop for both the biosimilar products and the branded product at the end of the day. So it really, last I checked on it, it didn't really matter which product you went with. You were getting a really great net cost at the end of the day, and it was significantly better than it used to be just due to the competition. And so that's why we feel it's really, really important to invest in the marketplace and ensure that there is competition. And so, as Casey mentioned, from a formulary strategy perspective, we have placed, a couple of biosimilars on as preferred, Hyrimoz and the Sandoz generic adalimumab-AD-AZ. And it's in a co-preferred position with brand Humira, and that's our strategy for 2024 as well. We feel like that is the best position for clients today from a net cost perspective. It gets them the best option in terms of best net cost and utilization for members, and it takes in all of the factors that Casey just went through. I know they were really complicated and it's hard to keep all of them straight, but that's why it's important to look at all those various pieces, because each one affects, member experience, and at the end of the day, what the experience is going to look like for you as a client as well. So let's move on. And in particular, I'll talk a little bit about how we are specifically investing in the biosimilar space, and that is through the creation of a company called Cordavis. And it is Cordavis, not Cordavis. I actually clarified that this morning with a number of people to make sure I was pronouncing it correctly. And, that's what it is it's essentially like a co-manufacturing. And what's not really well known is that in the pharmaceutical manufacturer space, a lot of the actual logistics and production lines are outsourced to other companies. There are companies that specialize in that and do that for them, and that happens a lot in the manufacturing space, and that's similar to what Cordavis is doing. And I'd also compare it very closely to Red Oak. Red Oak is a partnership that we have with Cardinal. Cardinal is one of the largest wholesalers in the country, and it's a partnered GPO to generic purchasing organization in order to purchase generic products, ensure that we can get really good prices on those products, and ensure supply of those products is consistent and available in the marketplace. And that's really where Cordavis comes in, really beneficial from us from that perspective. Is we're very confident it can help bring biosimilars to market, bring it to market faster. And in a way where we're confident that the supply is going to be readily available and usable for members at the end of the day. And then one of the other advantages too is that we can have a little bit of say in the pricing in terms of the strategy and how it's priced at the end of the day. And so, as you can see on the slide, we've contracted with Sandoz initially to commercialize and co-produce Hyrimoz. And one of the interesting tidbits is that Hyrimoz, when it's provided directly from Sandoz, is considered a high WAC product. It's still really good from a net cost perspective. It's high WAC with a nice rebate on it. But through our partnership through Cordavis, we're able to bring Hyrimoz to market in a slightly different NDC and be able to price it at a low list price. So we're basically able to say, hey, let's not do a high list with a rebate. Let's provide it to clients at a low list price because we feel like that's more transparent. That's more what clients are looking for in certain scenarios. And so that's one of the advantages of bringing that product to market in that way. And ultimately, as you can see, it'll be 81% lower than the current list price of Humira. But I just want to call out again that competition drives down price for everything, both brand and the biosimilars. And that's why, we're really positive on the competition, but why I would say we're in a co-preferred position for 24 because we feel like that's the best scenario from a net cost perspective. But with that, we can move on, and I'll talk a little bit about provider outreach. And so, Casey talked a little bit about some of the clinical considerations that are important for biosimilars. And one of the other aspects that's really important is engagement with providers around biosimilars. And so we've done a number of studies. We've looked at a lot of data from the external market around physician acceptance around biosimilars, and it's really quite interesting. So physicians that have experience with biosimilar products, so in particular rheumatoid arthritis, physicians that would write for that disease state, a rheumatologist, have more experience because there are products in their disease state area that have biosimilars. And so when polled, they don't have much concern in terms of switching from a brand to a biosimilar or back. They feel like they're fairly interchangeable and don't really have a preference for one over the other. When you get into some of the other indications that Humira has, like psoriasis, the dermatologists don't have nearly as much experience with it. So they're a little hesitant. And so that's where it becomes really important from our perspective to reach out and engage with the provider community, make sure that they have an understanding of what biosimilars are. And then we leverage a lot of our other assets in terms of, our leverage through the EHR, our connection to the electronic health record. We're able to pull some records over into CVS Specialty and see some of the the clinical criteria that would be set up from the doctor's office. We're able to use that to be able to fill out prior authorizations and do those a little bit faster and ensure they're done accurately. And that also helps take a little bit of a burden off the provider's office, which is really important because they're really, really feeling the burden around PAs right now, and been pretty vocal around that in general. But we have a really good process there. And then the other thing I'll call out is just our process from a member perspective. And so here you've got a couple of things on this slide that talk about our digital connectivity with patients. We've got a number of scenarios. The biggest one I usually call out is our direct messaging through the app from a specialty perspective. We're able to get with members and talk with them about side effects that they might be experiencing, on day 2, 3, 4, or 5, and really have some good conversations with them. If we're switching them to a biosimilar, we can message them through that and help them make sure that they're comfortable with that. And then we also send out letters. So if we were going to make a switch, if we were going in a direction of saying we're going to switch out preferred products, we would letter them. We send text messages. We have a number of leverages that we can use there to make sure that members are informed and help them through that process. Fortunately, that's not going to be necessary for One, because we're taking a co-preferred approach, so members don't have to switch off of their current product being brand Humira. But I just call it out because if there was ever a scenario where we did, or in other categories where other biosimilars come to marketplace, if we needed to make a switch, we have a number of different things we can leverage from that perspective. And then, I'll close out here, and then we can move on and take some questions real quick. But, in particular, I think Casey showed you, a little bit of what the market looks like in terms of that. In terms of pipeline, there are a number of other things out there that are coming from a biosimilar perspective. And again, you saw the numbers, you saw the price points that we put out there in terms of what it could look like from a volume perspective. But you've got biosimilars for Stelara coming. There's a number of other products, as you saw in some of the previous slides, that are coming to market. And we really feel very, very good about the potential for biosimilars to really start to bring costs down, in the specialty space. And one of the best ways I've heard it compared, and I'll date myself a little bit in terms of my time in the industry, is to when Lipitor came out. So Lipitor came out, and it was a huge blockbuster item, and everybody's worried about how to afford it and what to do. And then ultimately, generics started coming out, and this was around the time that generics were a little bit new. We didn't know a lot about it. We didn't know how the process was going to work in terms of interchangement and pricing, and ultimately investing in that marketplace resulted in rapid price compression around those products. At the end of the day, it really brought the price down for those products in terms of what clients and members would have to pay. And we expect a very similar result from biosimilars on a long-term basis. We're already seeing that price come down in 23 and into 24, and it'll just continue to play out. And we expect it to be pretty rapid, especially in the Humira space, just given the volume there, both from a revenue and both from a member count perspective. It's almost always one of the number one spend items for a client. So it's obviously on everybody's radar at this point. So with that, I think I'll wrap up a little bit, and I think we can move on and take some questions. So I'll pass it back over, and let's get some questions going.
Perfect. Thank you both for that informative presentation. I know biosimilars are a very hot topic right now, so it's good to be reminded about everything going on in the marketplace. I have seen some questions come in, but as a reminder, if you do have any questions, feel free to submit those as we talk through some of these. The first one here is, I know we were just talking about cost and how, competition is really important in this space. So will Cordavis's Hyrimoz be priced lower than the other versions?
So I'll take that and say yes, it will be. And so as I mentioned, the Cordavis version in particular is coming out at a low list price. And I would say, we look at all of the various scenarios out there, and the goal of Cordavis is to bring, low net cost products to market, regardless of whether that's low list or high list with a rebate. But in the scenario of Hyrimoz in particular, we saw a lot of value in bringing it out as low list product. We saw that as kind of preferred from clients. So yes, it will be low list.
Perfect. Another one in here is, recently there was coverage regarding the FDA's recommendation to omitting altogether details of interchangeability from biosimilar labels. Can you provide your perspectives on this?
Yeah, I'll start with this one. Travis, you want to add anything? I think this is exciting news. It's going to really provide the opportunity for additional uptake of biosimilar utilization. Again, it hasn't passed yet, but it did come up. And what this would mean is that interchangeability designation that I had referenced, if that is removed, while state laws still could apply here and could differ by state, that interchangeability designation would not have to be included in the label. So we could see increased utilization of those biosimilar products, which is exciting. So we are an advocate for that.
Yeah, and I'll just add on a little bit so from our perspective, we've always had interchangeability on the radar. Casey went through it in the regular presentation, and we've known that it's a factor and definitely something that we're looking for. And I would say, as time has gone through this, this year, since multiple biosimilars came out in July, we've seen it be less and less of a concern from a physician or prescriber point of view, to the point that they're now actively advocating to the FDA to say, we got to get rid of interchangeability. And I think from a purely clinical perspective, they're looking at it as it's creating two tiers of biosimilars, and there can be a perception that a interchangeable product is better than a non-interchangeable biosimilar. And we've known that that's not the case. And I think fortunately physicians and the prescriber community as a whole is recognizing that. and asking the FDA to say like, hey, this just isn't necessary. It's not done in any of the other countries that have biosimilars, and so we really ought to get rid of it. Now, I'll caution and say that the FDA is very slow and methodical on things like this. So I don't believe that they're going to remove interchangeability, in a couple of months. We may not even see it go away in 24, it may be 25 and beyond. And it's not necessarily a bad thing. There's a lot of really good reasons that the FDA takes its time. And so they're out right now. They've got some draft guidance out, and they're waiting on feedback from the public and from physicians and a lot of other clinical groups around what they're looking to do. But in general, we're really happy with the direction they're going and feel like it'll be positive for everybody.
Absolutely. Let's see. The other large PBMs have also preferred branded Hyrimoz. Would you expect through Cordavis's relationship for CVS clients to have a more reliable supply of the product?
Yeah, I'll take that. And then, Casey, you can always chime in if you've got any other thoughts. So it's a really interesting question, and I'll answer it with a long-winded answer, which is what I'm kind of known for. So initially, I would say yes, and that's just because Cordavis is a brand new entity that we're building up and just getting running. So an initial ramp up, you're going to see, I'd say, more supply at like CVS Specialty than you are other places. But long term, and when I talk long term, I'm talking like mid 24, late 24 and beyond. No, Cordavis is not intended to only be a supplier to CVS or to CVS entities. We intend to make that available to everyone in the marketplace. So anybody that wants to purchase from them and pull in products that Cordavis brings to market will be allowed to do so, just as long as we can support supply, which we expect to be able to do. So I think in the short term, yes, there's definitely an advantage for CVS clients on that. Long term, we don't intend to hold it that way. And really, it's just because we understand how important investing in the biosimilar market as a whole is, and bringing it to market just for our clients or just for our benefit is not really going to get the long-term results from biosimilars that we're looking for, both for our clients and for the marketplace. So that's really why I think on a long-term basis, you'll see Cordavis be, kind of an equal opportunity supplier.
Great. Yeah. And I think this kind of leads into our next question as well is, will there be manufacturer assistance available for Hyrimoz? What of those utilizing a reference product with solutions like PrudentRx will being moved to Hyrimoz eliminate an opportunity for those types of programs?
So I'll start with that one. So that there will be manufacturer assistance available. And for our clients that do have, I think I'm going to summarize this question to make sure I capture what I think the intent of the question is that both products, whether it's the reference product Humira as well as the biosimilar Hyrimoz, they are going to be a part of the PrudentRx solution. So if you are enrolled, if clients are enrolled in that solution, both of those products can be received at $0 cost share. So I think that's where the question is going. They are both co-preferred, as Travis and I have said. So today, there's no incentive to move for either of those for those scenarios. They're both adjudicating at the $0, just like they are today, adjudicating at the same copay. So there's no differentiation there. I think so that's where that question was going.
Yeah, and let me add and just say, from a more broader perspective, in the conversations that we've had with manufacturers that are bringing biosimilars to market, all of them intend to offer some level of patient assistance. We've talked to them about, products like Prudent and the importance of it, both for our clients and for members. And I think manufacturers, even separate of that, recognize that in the space we're talking about, patient assistance is really important just to their strategy from a manufacturer perspective. So they don't expect that you're going to see very many biosimilars come to market without a patient assistance program at the end of the day.
Makes sense. It looks like we have a few others in here, kind of going along with the member cost and just getting it prescribed in general. How will CVS use its enterprise resources to increase prescribing of biosimilars, including the Cordavis products?
So I'll start, and then Casey, you can chime in if you've got anything to add. And I'll say I'm going to kind of split this one a little bit because we're definitely doing that. We've got teams that are out messaging prescribers and talking about biosimilars. A lot of what I went through kind of on the slide is we're talking to them about, how biosimilars are just as good as the reference products, can be prescribed. But in particular, I'll call out with the current strategy around Humira, we're not messaging prescribers to switch between one product or another. They're co-preferred for a reason, because any of those options are lowest net cost. So when we're talking to them, we're saying like, hey, there's no need to switch off of Humira. It's perfectly fine. It's preferred. But just know biosimilars are available. If you're interested in that for another reason, they're out there. And then in general, we're trying to make sure that prescribers are comfortable with the biosimilar products, so that if in a different scenario, when other more biosimilars come out, if we take a biosimilar only approach, we're not going to see any issues in terms of prescriber adoption. And I would say we see a lot of positive receptivity around that right now. But I just call it, it's not really necessary today. As we get into 24 and beyond, we'll see how things change. But for the time being, just specifically around Humira, it's not super important given the co-preferred strategy.
Yeah. The only thing I would add there is if you go to CVS Specialty, if you go to the website or the caremark.com website, I do know that they have member education materials available just surrounding the biosimilar space. It's value, some educational resources in case you want to access those, but then they're available. We make them available.
Great. Yeah, I know it's going to be really important for these members to understand how these products even work or what the differences are. So I think all of that will be very helpful. It looks like we have one last question. So just a reminder, if you have any other questions for our speakers, please feel free to submit those before we wrap up today's call. But to finish off, we had just been talking about the prescribers and how they don't have to switch the products. But if they were to, what would a prescriber have to write in order to have CVS Specialty dispensed the private label Cordavis Hyrimoz biosimilar?
So I'll start, and then Casey, you can chime in. And so this is one where what I'll start and I'll say as a reminder is biosimilars are branded products. So at the end of the day, just because of the design and how biologics work, they're branded products, just like the reference brand is a branded product. And that's actually why we say reference brand, is to try to differentiate and make sure everyone understands when we're talking reference brand in the adalimumab space, we're talking Humira. So from that perspective, if a prescriber wanted Hyrimoz to be dispensed, they would need to write for Hyrimoz. Unfortunately, today they're not able to just write adalimumab on the prescription and just have any of the adalimumab products dispensed. The positive thing I would say there is, with the FDA looking at the interchangeability scenario and possibly removing that, we may see some changes there where prescribers could potentially do that in the future. I think that's probably still a ways away. We would be very much for it and very positive on it in terms of member and prescriber experience. But as it sits today, they would have to write Hyrimoz in order to get that specific product.
Travis, I'm going to pad that question for you because I'm sure people are thinking, so Hyrimoz is two different products. There's a Sandoz and Cordavis. So I don't know if you want to add anything, or I'll add is that, when the Cordavis product becomes available, either one could be given if Hyrimoz is written on the prescription, either one of those manufacturers.
Yeah, that's correct. So at the end of the day, that is a good clarification. They don't have to write Hyrimoz and then put Cordavis. That would be too complicated in my opinion. So if they write Hyrimoz, either the Sandoz direct product or the Cordavis product can be dispensed in that scenario. So that is at least one positive.
Awesome. Well, thank you for clarifying. It seems we don't have any more questions at this time. So we wanted to thank everybody for joining us today. And we hope that you and your families are staying safe and healthy and have a great rest of your day. Thank you for joining.
Thank you.